Good evening, ladies and gentlemen. This is Jack Callow with the Exchange. Tonight we have a rather special guest, one that I wasn't really expecting. So, if you'd like, please introduce yourself.
All right, hello. My name is Dr. Justin Cooke, and I am the Surgeon General of the San Andreas Medical Services.
So, career-wise, where have you been? Were you always Surgeon General? Is this a slot that you were put in, or did you do anything previous to that?
Well, I've been employed with the department for about 3 years now. I started at the lowest rank and slowly made my way up to Surgeon General. It took a whole lot of hard work and way too many hours to count.
And how did you transition from previous role to being Surgeon General? Was there a learning curve? Was it more or less what you expected?
I would say the prior Surgeon General Lewis did a pretty nice job in at least lessening the learning curve, but with any new position, especially one of leading a lot of people, there's always that learning curve there. Because there's no instruction manual on how to lead people or to lead a department, especially one as large as Sam's is.
And it is a rather large department. That being said, can you walk us through a day at Pillbox? And I don't mean just you as a Surgeon General, but things that you would experience when you were still working, as you say, the lower ranks of the hospital, or things that your coworkers might go through on a day-to-day basis.
Wow, that's kind of a loaded question because I would say it's been a lot of patience. Well, patience and patience. Because I'd say on the average day, I'd see like 30 patients usually, see at least 10 surgeries some days. I'd say I saw more surgeries at Zona than I do here. But obviously, at Zona, I was not in the position of Surgeon General. However, I still do take patients, though.
But you take far less now that you're a Surgeon General.
Probably not, I would say.
Get promoted, still have the same amount of paperwork, I guess.
Yeah, partially it's because I'd rather be the head that does something to help people instead of being an administrator. Because I think when people think of Surgeon General, they think of being an administrator.
Oh yeah, it's what we've always assumed the Surgeon General was going to be, you know?
I think so, because if you look at other states and who leads their hospital, a lot of times you see a lot of administrators who sit in an office. However, I'd rather not sit in an office and instead take patients.
Now, you're not the first Surgeon General we've had in Los Santos. I believe you're around the third, fourth?
I would be the third.
Third Surgeon General. And before you, one of our more notable guests, she spoke with us in our earlier days, was Maggie Martindale, who I believe goes by McCormick now. She got married after all?
She does. Yeah, she got married at Eclipse.
Oh my, that has been a long time.
It's been a very long time.
From when she ran the hospital until now, what do you feel has been the biggest change in how things are operating?
I would say biggest change has been, people's one, but it's also how the way we think about things. Because we don't think about things in an individual manner. Because a lot of times, if you're a doctor, you rely on your own knowledge to get things done. I would say now we rely on our team and each other to get things done. Because if I can't work well with the person next to me, then how are we going to get anything done? I think there was a lot of focus on the individual back then instead of on the team.
And now you feel you guys are closer together.
I would say we're probably the closest that our department has ever been.
So do you feel that you've improved in some areas, but are there any areas you feel that you have fallen short in?
I'd say retention is one. Obviously it can this position does have a lot of attrition. And I'd say like losing the people who might commit a crime, who probably could have stayed, but instead they made the choice to commit a crime, or they made the choice to leave out of being petty or angry with a random thing.
And
we find that.
Oh, sorry, go on.
No, I was saying we find that people sometimes get really unhappy over the smallest of things in this profession, which, you know, I suppose is a thing, but which I will never understand, I don't think.
It's a pretty charged profession. I mean, you are dealing with death at all times.
Yeah, it can be very charged because, I mean, there's a lot of stress. You have a lot of patients. You have police coming in here, locking down the place every day. I mean, you can understand why some people like to they get a little snappy.
Oh, of course. Like, those are conditions I wouldn't really wish on anyone.
No, and yet we still make it through every day because, well, like I said, teamwork. I mean, use the old cliche of teamwork. But it really is just the people around you that make each shift better.
Do you see yourself making any more changes as time goes on that you're allowed to share with us? Obviously, we're not going to ask you to give us all your secrets.
Well, we like to do more press releases to the public, and hope maybe give out a mission statement at some point, just so the public knows and is confirmed to the public that we are dedicated to them.
That's a big step forward. That's something that even more established departments don't do.
I think it's one of we do help with events or help with blood drives, but I think it's taking that next step just to really establish the public's faith in us. Because, you know, we remember we like to use Maggie for an example in her time of where people didn't trust, and it's kind of become a motto of never again to do that kind of thing or have that kind of thing happen.
And that's perfectly understandable. But that being said, what are your thoughts on the current state of the government departments in regards to how to communicate with civilians on government matters? Because right now you are coming out, and this is probably like the first time I think anyone from SANS has been interviewed in a long time. So you are showing that step toward transparency, but do you feel the rest of the government is making steps towards that, or do you feel they're not doing enough?
I mean, I think more can be made. I mean, obviously within reason. I mean, we have seen how wide can be with people demanding things from police or whoever. I think definitely within reason, departments should be communicating more. And obviously it can be very tough. But I think more steps can be taken.
And do you feel that your current relationship, not just as Surgeon General, but as a department with other branches of the government, do you feel there's an open line of communication between each other? Do you feel you don't communicate enough when you're supposed to?
I think it's been more touch and go than I think anybody would have liked, at least currently. I'd say there's always room for improvement with communication. And I think just hopefully soon we can, as government departments, we can communicate better with each other. Because I think sometimes either departments aren't educated about how each other operates, or we don't take the time to even consider how a department might communicate with one another, or with outside sources as well.
And what areas do you feel you can improve on as far as communication goes? Do you feel that they don't provide enough backup, or that they don't understand your procedure?
I think at least for us, we find it's procedural. I mean, obviously in medical, there's a lot of things you need to consider, whether privacy or safety of patients, or, I mean, even just locking down the hospital. I mean, obviously it's hard to understand. I mean, it's hard to read a book of procedures, and it's even harder to understand the procedures of another department too.
Yeah, so that can go both ways regardless then.
It can. And I think I think it's hard sometimes for other departments to grasp each other's procedures, which
Yeah, of
might
course.
mean making an effort to communicate. That would be beneficial for everybody too.
Oh no, of course, because there are SOPs that they have to keep to themselves, and every department has their own set.
True. I mean, as we saw on Y the other day with people demanding SOPs and all of that.
Oh yeah,
And
I saw that on Twitter. Oh
that's,
my.
I mean, it was something to see, but it was also something to think about too, because obviously no department wants to release SOPs. I mean, that's not going to happen.
No. It's a loaded gun. I understand that. Now, I'm a person who loves transparency, but even I know that that's a bit dangerous.
Oh, I agree. I like transparency too, and part of that has come from learning from experiences and I mean, internally and externally. But I think there are ways for transparency to happen without having to resort to, oh, here's the open book of SOPs.
Now, this next question is, of course, optional, but it is a rather hot topic issue at the moment. Now, it's no surprise that, well, not really surprise, but it's no secret that Miss Crystal currently has a petition going about abolishing the death penalty. Now, there's a lot of people in favor, some people against, some people are still on the fence, don't really quite understand it. But if I can ask, like you as a Surgeon General, or even just as Justin Cooke, what are your thoughts on the death penalty?
I feel like that is the most loaded question other than police of the day, I think.
Oh, it's completely loaded. I apologize, but it is.
The most loaded question of the day, I think. I mean, I think there is a good reason for debate for it. But I don't know. I'll be honest, I haven't pondered it because we really haven't had that many death penalty cases in the state.
We've had quite a few.
Oh, well, I guess that goes to show I need to keep track of our cases a bit more, I think.
No, it's because it's not really publicized. Like, it's not put all over Weasel News. Hey, today we're going to have an execution.
Obviously, I mean, that is very inhumane.
We don't want to add sensationalism to enact the barbarism.
No. Yeah, like I said, I think it's a hard topic for people to even wrap their heads around, too.
Well, yeah, there's a lot of factors to consider when it comes to the death penalty.
There is.
Like, someone's crime, is it appropriate punishment? Like, the suffering aspect. There's a lot of layers to that question, and that's why I feel like I should ask you, You've worked from the bottom of the hospital all the way to Surgeon General. You've seen not just victims of these crimes, you've seen the killers themselves. So I feel like your opinion carries
that for
weight.
me is where I'm so divided because I've seen the worst of the worst of people and the worst of the worst of injuries and death even, but we also understand that, I mean, death penalty is also a very inhumane thing too. So I don't know if I have exactly a 100% answer for you or the audience right now.
And that's all right. Questions are made to make us ponder. It's something to consider,
I think it will continue to make people ponder, especially this term as well.
I do not envy the governor and the state reps because this is a really, as I used the word earlier, charged term.
It is, and I would not want to be in their position either with this.
No, they're coming off of a hot election. Well, the governor and lieutenant governor are. But the state reps are also walking into a situation now where we have a man on death row, a man who is, well, in all sense and state of the word. There's a petition to stop his execution from going through should he be found guilty. But I've also had Miss Crystal tell me that apparently someone who chopped off 2 people's heads only got 100-something months, 17 years. So it's kind of it raises questions. And I feel those are questions that we're not ready to answer yet.
I don't think we are either. And I think it will continue to be debated in the public sphere for a bit.
It will. And that's not a bad thing.
No, it's really not.
That being said, do you have any like closing remarks?
I do. So I would like to thank the people of the state for having faith in us and for coming back to us, because I know there were some rough patches for a while. And we'd like to continue to take in everybody, regardless of who you are, what you do, and continue to provide you with the best medical care out there. And I'd like to thank the best team ever, obviously, in my department. I mean, I cannot get it done without any of them.
Besides the audience, the people of the city, obviously, and your wonderful team, is there anyone you want to personally shout out? Someone who you feel like you either owe a thank you to or just want to, like, say hello to them?
I'd like to shout out Seraphine Wren. She is the second in command of the department. She works extremely hard. Sometimes she doesn't see the gain of it, but I do. And she's a very special person that works for us and helps me with the day-to-day. And she should definitely get more praise for that.
Seraphine always has been a rather wonderful woman.
She has, and we are extremely grateful for it.
And now the final part of the question, and this is always like my favorite question at the end of the interview, I'm not gonna lie. Is there anyone you feel like calling out? As in either calling them out on an action or calling them out to do a similar interview such as this?
Oh, that's I would like to challenge each of the department heads to have an interview like this. I think it would be good for all of them, whether they've done a good thing or a bad thing. I think all department heads should talk to the press at some point, because the press are not enemies, as much as some people would like to think in departments sometimes.
I try not to be. I feel like I'm a rather impartial journalist.
Very much are. And I think it would be good for department heads to speak with the press.
Maybe in the future they will. We'll see how this term goes for us.
And I hope it goes well.
That being said, you have been a wonderful guest. I really appreciate your time, and hopefully this is the future of rather open communication between not just us here at Weasel News with you, but other news outlets out there in the city.
I agree, and we are happy to work with the news when we can.
Wonderful. That being said, ladies and gentlemen, this is the end of the exchange for now. Thank you for tuning in, and I'll see you all later. Have a good night.